1 or 2?
2.
3 or 4?
4. Hey, you know what? Let me ask you something. When was the last time you had an eye exam? Well, if it's been over a year, we're both in trouble. But the good news is I'm in the right spot for that. I'm at Nationwide Vision's Medical Center, and this is Dr. Joseph Myers, and it's so nice to meet you, Dr. Myers. Thanks for having us here.
Absolutely.
I have already learned so much from you. First of all, how often should people get an eye exam?
Well, that's a great question. A normal eye exam should be on a yearly basis, unless there's other things that are going inside of the, on and inside of the eye. But for a standard care, most patients can be seen on a yearly basis.
Okay, all right. And you know what? A lot of people, you know what? I think they think that they go to Nationwide Vision to get glasses, but you guys offer so much more than that, including eye exams.
Yeah, so the dynamics of optometry have kind of changed over the last few years, and kind of leads us more into the medical model. Not everyone that has their eyes checked truly does just need glasses. There's other things that can be causing problems with the vision, and I think that's kind of a misconception that patients come in thinking it's just the glasses that need changing, I just need new contacts, and there's lots of other things that could be going on inside the eyes.
Right, and things that you don't even know, and it's not really just about eye health. You can actually discover some unknown problems or issues that people are having through their eyes.
Yeah, we get a really good view with a dilated exam in the back part of the eyes to look for changes in the nerve, changes in the macula, changes in the blood vessels. I often tell a lot of my diabetic patients that it's kind of like taking going to the doctor and peeling the skin back, because that's how they see the blood vessels. But we can just do it with just generally dilating the eyes.
And I find that fascinating, because somebody could walk in, you know, to get an eye exam feeling perfectly fine, and you discover things through their eyes that they didn't even know was happening.
Yeah, a lot of things can be going on inside the eyes: diabetes, glaucoma, changes where patients are completely asymptomatic. They can go on their day and feel like things are fine, and a lot of these symptoms, a lot of these signs and changes in the back part of the eyes can be going on without even their awareness.
That's unbelievable. So what is the number one, I'll just call it an issue, that people come to you for when they think that they have a problem?
There's a full spectrum of issues that can bring patients in, but a lot of this practice is a lot based on diabetic patients. So yeah, there's 30 million people out there in the U.S. that have diabetes, type 1 and type 2 across the board. Most patients, though, if they are type 2 diabetic, can have problems inside of their eyes without them even knowing it.
And on top of that, you can also look at things for macular degeneration and glaucoma, and really tell people if they are predispositioned for it, or...
Yeah, we can tell that by a general eye exam, and that's what we have a lot of the specialty testing here at this clinic for, is to be able to manage and treat the issues that are going on with diabetes, with macular degeneration, with glaucoma, kind of on down the list. We have the capabilities here to be able to do that.
What about cataracts? Sometimes we can see them, you know, in other people. Are they there even if we can't see them?
Yeah, it's a change to the lens that's inside of the eye, a buildup of kind of proteins over time. I often tell people that if it changed overnight, we'd have a line outside of the door down 2 or 3 miles worth. But it is such a gradual appearance that most people don't pick up on it until it gets really bad, and then they come in just for a glasses change. Again, not an issue. The cataracts can come out, the vision can go back to normal, even better than normal now, and make vision clear.
Wow. Well, and that's the good news, right?
Absolutely.
That there is something that you can actually do about it. And that's why it is so important to get your eyes checked on a regular basis. All right, here's more information. Well, Nationwide Vision Medical Center is located at 2222 East Camelback. That's in Phoenix. Give this number a call to book your appointment, 602-840-3501, or you can always visit nationwidevision.com for more information.